Health authorities in the country say from data available, the number of confirmed cases tend to be higher in provinces which report doing more testing. There is a steady increase identified in influenza-like illnesses and severe acute respiratory infections around the country, with swabbing and testing of these individuals for COVID-19 rarely done. The Health Secretary says 4 vaccines from the COVAX facility are before the National Executive Council in the approval process.
So at this point in time, there is, again, through the WHO, DFAC, and the department, we're taking consideration of 20% of the population, and the first being the health workers, frontline health workers. Then our age, what age group we should consider is the issue that the working committee, technical working committee, will decide moment the government gives the endorsement of the deployment plans that we have. And again, those with high comorbidities, like those with diabetes, hypertension. And of course, we consider those that of the extractive industries, mining and companies that fly in, fly out our international borders. Those will be considered under this EUA.
The general public have expressed mixed views about the proposed COVID-19 vaccination program rollout, with some having doubts about the disease actually being in PNG and also not having confidence in the vaccines. EMTV News spoke to some of them.
Meeting was this like sickness, it's a created sickness. You know, sickness where mi plus tumbuna plo mi plana, generation plo mi pla no got this like sick. So something well China like testing this like something lo all man or this like number so also testing selo country lo liat. Mi pla Papua New Guinea so far you know got plenty die come up lo COVID-19.
Supposed me got this like COVID-19 this like test positive. Then me kissing me more better than all by giving me nothing. Me by kaya no God.
Me feel confident lo kissing. Marasin. Unless suppose to talk good, explain him good, Marasin will make him osanem, kamos osanem. I think I'm right to mix him, but else it's not necessary to mix him.
But others think it is necessary to take part in the vaccination program for protection purposes.
It is a must, you know. We should have it, you know. We should have some here in Papua New Guinea to stop the spread, because, you know, if it spreads to people like my age group, certainly it's going to be devastating. You know, it's going to kill a lot of people.
Yeah, mi ba mas lo kisim Marasin. Na ol pikinin itu ol pikinin na imi ol kata man meri sa paso se mol kam tok lo kisim mon pla Marasin kam na ba ol givim lo imi. Mi pla ba ol kata mas tasol lo kisim lo protect him imi.
Some members of the public chose to speak off camera to express their views. It is also a hot topic on social media. A science academic at the University of Papua New Guinea expressed last week that Papua New Guineans seem to have some natural immunity to COVID-19. He says vaccination can only be rolled out if really necessary.
In simple terms, vaccination is only given to the group of people that require vaccination. According to what I said, we have certain level of immunity. And it's okay, you can get vaccination if you do not have some level of protection.
So when people are saying that we are immune, that's not true. So we are for us we are working as if we are in the same exposure as probably other countries, as you can see them.
Certain members of the public also expressed concern over the whole vaccination campaign, saying it may have underlying motives.
COVID-19. Nuko tikat narpla recent or just product come na or testing